Now, how to do work with this? So there are a lot of gardens in the field of acupuncture, which is having beautiful stars, out of which we are taking 5-element theory into a disease. 5-element theory into what?
Disease.
Yeah. By inserting just 4 or 5 points, you can recover a patient nicely. For that, you don't need to memorize. So what are the basic principles? We know yin and yang already, right? Yang is a male energy, yin is the female energy. Clear? So nothing to worry about that. Now, let us take about the organs. The organs which continuously work are called in organs. So in this case, of 5 elements, we will select only 6 into 4, 24 points. How many points? Out of 24 points, we have to select how many? 4 or 5. Am I clear?
Yes, sir.
Up to now, am I clear?
माझा आवाज का नाही त्याच्याकडे?
Am I clear up to now?
Yes, sir.
Clear, sir.
माझा का नाही?
Not clear, G. How we get the 24 points?
It is 5 metal points.
5 metal
Just type in Google 5 metal points.
So it should be 25, right?
6 4 are 24. Hands carry
Sorry?
3 in channels. Legs carry 3 in channels. So each in channel has 5 elements. So 6 into 4, how much?
24.
Am I clear?
Yes, sir.
Here. Walid, can you allow me to share?
Pardon, sir, your voice up and down.
Walid, can you allow me to share?
So you want to share?
Yeah.
Let me make you co-host, sir.
So here you can see the 5 element point. Where are the points? Can you see?
Yes, sir.
Here you can see. Lung metal point is LU11. Heart fire point is heart 9. Pericardium fire point is PC9. Spleen is 1. Kidney fire is K1. Liver Liver wood is liver 1. Right? You understood? So, how many points are here? 1, 2, 3, 4, 5, 6. 6 into 6, sorry, 36. 1, 2, 3, no, 24. 6 5s are 30. 1, 2, 3, yeah, sorry, 30 points. We are going to use 30 points. How many?
That's
30 point.
Clear? Up to now, things are clear to you?
Yes, sir.
The junk
Sir,
food.
explain once again, sir.
Huh?
Sir, explain it once again.
These are junk food organs. Each junk food organ has 5 element points. These are the 5 element points. See, go in Google and write 5 element point. You will get it. So simple. Or they are called 5 shoe points. Am I clear?
Yes, sir.
Yes,
got it.
sir.
Now, one patient came to you with what? I'm treating him right now. How many years? 30 years depression because he was deprived from his family. Right? They have given him Sizodone and everything they have given. In 5 or 6 days, he has shown some significant improvement. So what was this thing? Stress, deprival, loss of property, fight with wife and in-laws, taking too much biodata, and asking about details about everything. I treated him for 5 days and his symptoms has come down to how many? More than 50% down. How much?
50%.
50% down.
Yes. This is the power if you understand how to recover a patient. Clear? Am I clear?
yes, sir.
G,
Tell me.
yeah, you just select the well point, is it? Or the herb or the spring point?
No. I'll tell you how I took out the points. I drew my diagram. See, what you are using is memory, right? Are you using any formula? No.
Earth,
So the first vertex is what? We draw a triangle and we draw what? Earth,
earth,
right? wood,
water,
water. Then
metal,
Here,
fire,
fire. Very good. Clear? Now, this has to be brought into this. Now the heart is continuously firing.
Sir, you need to stop sharing so that I can get your picture back or you highlight you back.
How to stop sharing? Did I stop sharing? Stop sharing.
Now you stop sharing, sir.
Good, I've learned a lot. You understood?
What you are writing on the whiteboard is not very clear.
See, if I switch off the light, then also you won't be able to see what I am writing. So you have to hear what I am saying.
The marker got no ink, I think.
Let me use. Blue marker. Can you see now?
No, sir.
No, sir.
No, sir.
It's worse now, sir.
तो सामने से लाइट ज्यादा है इसलिए वो फ्लैश हो रही है.
क्या करें अब इसको?
Maybe you should use a brighter color, maybe a color red. Color red will be brighter. We'll see it clearer. Thank you,
The
sir.
lightning in the room just needs to be reduced a little.
I'll just try to fix that. क्या हो?
वो हमारे जो है लिखे थे
वो ये वो है ना वेंकटेश
yes, sir. On.
Sana saya percaya gak percaya mah nak di kamar kok gitu terus ya. Aku tetap ya, selamat tanggal. Nanti nak sini jangan bahas itu dulu soalnya pemulanya tak tanya papi soalnya enggak jawabnya.
Can you see me? Can you see me?
Yes, this is better, but it was a bit better before you went this dark, when you reduced it the first time.
Light is okay now?
Very good.
Can you see what I have written in the board?
Yeah,
Yes.
very
See
good.
what you have done? We can't see you.
Now
No.
we can see you.
Now can you see what is written in the board?
Yes, sir.
Huh?
Yes, sir. Hanji.
Here? What is this?
Earth.
Earth,
Earth.
This one?
fire,
Fire.
Now you can see. Thank you. I also have learned new things. एक बंद करके दो. Now can you see clear? No. Is it clear?
Sir, we can see the board, but aapka, it is, this thing is coming very dark. Your picture, your video.
वो ऑन कर दो.
It's
No?
good right now.
You see?
Better.
Better, sir, better. This is better.
I'm writing in the board, you can see.
Bagus.
Yes.
So, because of continuous stress, there was fire in the heart. What happened? Because of that, he became enmity to everyone. Okay? What are the inorgans we have? Name of the inorgans? Heart,
Heart, pericardium, kidney, lungs, liver,
liver,
lungs,
lungs,
Kidney,
kidney, and what?
kidney, sir.
Liver.
spleen, sir. SP.
Spleen, sir, spleen.
Right. The heart belongs to fire, right? Pericardium belongs to
Fire,
lungs, belongs to
metal,
metal. Kidney belongs to
water,
spleen belongs to
Earth.
earth. Now, how to treat this patient? There was excessive fire, so he destroyed the basic element of this area. He could not digest food. He had a gluten allergy, and he could not. He used to murmur. He used to shout. He used to talk too much. What happened in 5 days? These things went down.
So treat with fire and liver.
See, excessive fire transferred to where? Earth. This is the foundation. Right? From earth, it went to water. Water to wood. Wood to fire. So now wood again gives notices to fire. Means now he sees his wife, anything he sees or anything he remembers, he again gets irritated. Right? He gets irritated because of his past words. Yes? Am I clear? He gets irritated because of his. नीचे कोई पेशेंट है खोल दिया उसका he gets irritated because of his past thoughts. So what to do? The basic is spleen. It is that it notices the all. But first thing, what did I do is to what? Calm him down. How to calm him down? Which is the first point I will use. MRI, LS spine, all spine screening, or hip? Left hip. Understood? So how to work in this cycle? Is the first point you will use. Huh? Which is the first point you will use?
Sir, H7.
Again going with the for what you called memory, not with the cycle. See, fire is going again and again because wood is what? Noticing the fire. This pattern has to be broken. This is the main pattern. Wood is noticing the fire. Fire is what? Heart and liver. Both are what? Destroyed because of continuously taking seizure down for more than 20 years. The first point which I have used is
Liver 3.
no, sir. Kidney water point. Because fire, earth, who will destroy the fire this cycle? Who will destroy the fire of the heart?
Water.
Kidney.
Kidney. So first thing is what? I will notice the kidney. So first point which I will use is kidney water point, right?
Yes, sir.
You got my point?
G, you didn't use the reverse theory. Your
Yeah,
wrong
we
theory,
use
the counteracting.
encounter activity. This is
Yeah,
what I
it should
said.
be-
You must know how to encounter the patient.
So it should be K2, right?
Right. Kidney 2.
Kidney 10.
Kidney water point is K10 or kidney 2?
K5, sir. K10, sir. K10.
Kidney 10 is the water
K10
point.
is water, but I
K10,
thought your reverse
K10.
theory. Your
K10.
reverse theory is fire, right? It give back-
K10 is water point.
Yes.
Right. Then once the water is gone to fire, the wood also has started burning. So what will I do? I'll notice the wood. What I will do? I'll notice the wood.
Wood.
Yes. Because fire is coming down now because of water. Clear? And who's exciting the fire? This wood. So what to do? Wood. Wood point. Because I must notice the wood. Because the fire is coming down now. So once the fire is coming down, the wood is also burning less. So I must notice the lever. So the best noticing point for the wood is wood point. So what is the wood point? Lever wood point?
Liver 1.
Liver 1.
Liver 1.
Lever 1. So what are the 2 points we have taken?
K10 and liver 1.
K10 and
Liver
lever
1.
Now, I must stop immediately is past thoughts. So I must develop lot of what? Dopamine and in its brain. The best point, you have to mix here little bit allopathic area. What is this? PC6 and heart 7. This is the golden point for psychiatric disease. PC6, heart 7.
बंदा भी वैसा ही है, दिन रात काम करते रहता है, दिन रात करना चाहिए, एक आध 2 घंटा ही रेस्ट करता है, वो भी रेस्ट नहीं करता है भाई, आपके जैसे ही है।
PC6 and heart
7.
7.
So what are the 4 points we have selected to recover this person in kidney 10, lung 1,
Liver 1.
liver 1,
P6.
PC6,
Heart 7.
Not 7.
and most important part is earth nourishing point. So earth point. Earth has become what? Has become denourished. Who can nourish the earth?
Liver.
Who can nourish the earth?
The heart also.
Heart.
Who can bring vegetation to the earth? Who can bring trees to the earth? Water. Water. So what you have to take? Earth, water, point. जो आया था टेस्टिंग वाला लैपटॉप का कैसे अरेंज करेगा पता नहीं
SP9.
Yes, SP9 is the most important point. SP. Now let us see what does kidney 10 speaks support. The damp heat on the lower jaw benefits the kidney, elevates the pain. EC point, where the Q of the meridian collects and goes deep into the body. EC points are known to indicate to treat the rebellious Q of and diarrhea. You can see it is a EC point. What it is?
Easy point.
Yes. So what it will do? It will destroy the rebellious Q. There's a rebellious Q inside the body. There's a lot of destructive energy inside the body, right? Here, so you can see this point is correct. Now, we'll read which point? Kidney 10, then liver 1. What happened? You're welcome. आओ इधर आओ। ये खत्म हो गया क्या? No. Liver, one acupoint. So now it says a jingle point where the Q bubbles up. Jingle points are indicated to divide the consciousness. Now you can see. Did you think that you need liver 1 to treat this patient? No. But when you revive this point, you find out jingle points are known to treat fullness below the heart and clear the heat of the heart. There was a heat in the heart. The liver 1, what did it do? Clear the heat of the
Heart.
right. Then PC6. It calms the anxiety and reduces the calming the mind. You see, we used pericardium because it induces dopamine, PC6. So what does it right? Calming the mind and reducing the anxiety. Clear? Clear?
Yes, sir.
Clear.
Now comes heart 7. Insomnia, amnesia, cardiac pain, palpitation due to fright, irritability, chest pain, mania, epilepsy, stupor. So heart 7 was also our correct selection. Is especially excessive anxiety and worry, right? Am I right?
Yes, sir.
Okay, sir. Now comes spleen 9. See, temp heat of the lower geo, GC points where the Q of the meridian goes. SP9. See, this was being the gold damp. And known to indicate it to treat the rebellious Q and diarrhea. It treats his stomach was not good. Always, if you see in his history, his stomach was not good. So now you can see by using this formula and you see the name of the points. All the 5, 1, 2, 3, 4, 5. Did we think at the beginning of the disease we will use these points? Huh? You think? So this is the basis of formula. If you make a formula and you understand a formula, you can treat large number of diseases. You may ask me your questions. That how a very old depression case I am reviving. I thought I will not be able to do it, but somehow I think I am doing it. You can ask me your questions. Can you hear me?
Yes.
You can ask questions.
Yeah, gee, I thought last week you tried to show us the loan reversal theory, but today you're using the conventional.
See, you have to create a theory as per the symptoms of the patient. This is called the Golden theory of acupuncture.
Yes, but as you say,
It was written in where? Yellow Emperor.
yes, but as you say, you have fire. I use the fire to fight the fire also. Of course, you can
If you
use
put
the
more
water.
fire in the fire, what will happen?
Your reverse theory.
He'll become more angry. You have to cool him down.
Right. So, but last week you're using the fire.
You have to see the disease of the patient. Don't go by the what points. Don't go by one formula. See the disease and try to understand what is the problem with the patient. And correlate.
Yes.
Because out of 365 points, what points will recover him?
Correct.
You need immediate recovery, otherwise the patient will run away. Questions?
Sir, sir, we can include the auricular acupuncture.
See, auricular acupuncture also you can include, but the issue is that what is the patient suffering from? If these points are available in auricular acupuncture, you include this.
Sir.
More questions?
Good evening, sir. The
Yes.
point T6 and H7 are used because the patient is from the psychological disease.
Yes, it is a very chronic disease. So you have to be very careful while you work with very chronic disease, 30 years psychiatric disease. And you have to calm him down in how many days? 4 or 5 days.
Means
Patient told
T6
me that
and
the patient told
H7
me 7 days. See, when patient comes to me at the end of the disease, and I have to show results at the beginning of the disease.
Okay, sir.
So your strategy should be fast.
Means P6 and S7, we can use this point on psychiatric patients.
Yeah, you can use them for psychiatric patients, but along with this, you must have a strategy that how to clean the system.
Means use along with the elements point.
Yes, these are called soup points. These points are soup
And
points, and
why we
they are very
and
powerful points in acupuncture. Generally, it is said in 5-element theory, if you learn 5 in points, even if you see tongue acupuncture, it is based on in organs. Some of the young organs he have used, generally he has used in organs. And then you can see how beautifully the patient what? Revives.
and why we use SP9 here?
SP9 is what?
SP9 is a water point of spleen.
So here you see producing fire, right? So the energy of the wood has been finished. Clear?
Yes, sir.
So who will grow the wood?
Water.
Water. Where will you throw water?
Repeat, sir.
Where will you get water? Where will you throw water?
Water, we use, that's why the K10.
K10 we have already used it now.
Means spleen nourishes all things. That's why use.
No. Spleen 9 nourishes not only all things, but also it gives a reply to psychosomatic symptoms. How? By nourishing the rebellious key. It is called rebellious key. Now the energy, the Q has become rebellious.
Okay.
Its energy was what? Going in the right direction. Now it is going in the opposite direction. So you have to change the direction of its energy. Life is energy, my boy. It is not medicines.
Mickey means that there is a true lack of energy in the K10. That's why we use SP9.
Yes. You have to see SP9 is used for WSG. It was, it reduces the heat of the heart. It calms the heart. And now the patient is quite better in 5 days.
Okay, sir.
I'm saying my practical. More questions? Do you have more questions to ask? Do you
Yeah,
understand what I speak?
yes. Gee, so in this case, they are using the conventional point and not the brain acupuncture.
Yeah, we are using the conventional theory. You are right. We are using the conventional theory. So after doing many case studies, psychological, physical, neurologic, you will find out this really works.
Sure, it's time tested.
Huh?
Time tested.
Yes, it is already I have tested on the patient. Patient is good. So it is good and fine. There was too much light going on the board, so I changed the direction. Did you understand what I spoke?
Yes, sir.
That you can recover even depression from these acupoints. Provided your direction, and you know what is our difficulty? We memorize the points. PC6, Heart 7, these. We don't need to memorize it. We need to find out.
Find out the cause of disease.
Yes. It always says find the cause of the disease and disease can be recovered. Can you see now clearly? Can you see it clearly?
Yes, clear.
Now you have any questions to ask me? After teaching this, I'll teach you how to do NIDS in the same theory using scalp, and you get the same answer. Did you understand how to recover critical cases? Anxiety, depression, asthma, chronic bronchitis, all you can recover by through this method. These are called 5 SO points. You understand what was the problem of the patient? Acute stress, deprival of the body, in-laws, angry with the wife, always murmuring, keeping this, excessive thoughts in the mind. How to revive this? These were the points which I have used, and the patient is what? Today cool. Am I clear?
Yes, sir.
Any questions? Questions? कोई सवाल? No questions? Anand, did you understand what I spoke?
Yes, yes. Today case, I understand why the point are used.
Yesterday, what was the case? Kidney is nourished by?
Yesterday is the case of the LBA.
Yesterday was the case of LBA. Why LBA happened? LBA happened because of
the excess heat.
Excessive heat of the heart. So the first thing what will I do is I'll throw the excessive heat of the heart to heart itself, because heart is the king of what? Fire. So I'll
Fire.
throw back in fire to it.
Reverse back theory is used. We use the K2.
You're right.
K2 and lever 2.
Right. So you have to understand the theory, because you will get large number of patients with mixed symptoms, right? Depression, anxiety, these. At the starting point, patient will never say anything. But at the end of the conclusion, he will say, my point is, my pain is not recovered, my this is not recovered, my that is not recovered. I'm having this, I'm having that. Because the body is not calm. Once you calm the body, body recovers. Understood?
Yes, sir.
More questions?
Hello, Dr. Sastri.
Yes, yes.
How would we know when to use the counteracting cycle or the reversing cycle?
On the symptoms of the patient, how the patient is, the disease and reaction of the patient. It is why we are taking every day one case history to understand. It is taken from the yellow emperor, and then you must understand how to find out the points. Right now you are memorizing the points. You don't need to memorize the points. You have to find out the points. So you have to go with more case studies. One chapter or two chapter is not enough to complete. You'll have to understand more deeper this. Like today you understood one thing, that yes, even these things can be recovered. Because the energy is rebellious inside the body. What will happen? Brain will calm down. That is why I said in the beginning, there are two types of disease, acute and chronic. Acute diseases has to be treated by allopathic system, while chronic has to be treated by the traditional system. 1 minute, I'm changing the battery of the camera. Yes. हाँ. Ask questions. सवाल पूछिए.
क्या हाल है? ठीक है बेटा.
Ask questions.
क्या हाल है सर?
तो ठीक है. प्रकाश जी मुझसे पूछ रहे हैं. So by using this only 34 points, you can treat more than 200, 300 diseases. Irritable bowel syndrome, all these diseases you can treat, which I have treated in past.
Sir, you are looking nice and energetic, sir, today. And you will rest.
Thank you. Somehow I found a way to teach you all this. So I have to think and teach. Not
Yes.
easy to teach you such a complicated theory. Teaching is most difficult job. But by learning these theories, you can treat more than 200, 300 diseases. More than that. Chronic to chronic diseases you can treat.
Good evening, Sarji.
Yes, Alpana.
Sir, just brief about motor gate theory, sir.
See, motor gate theory.
Bulbar and spinal is also included in that.
Huh?
It
Pain
is
motor
motor.
theory.
Yes, sir.
Pain method theory is what you give excessive pressure, endorphin is released, and you don't feel the pain. It has nothing to do with this. ECM is based on what? What is your body? Why do we say gut feeling? Because whenever you insert these points, stimulation is done in the brain. Then with the help of G lymphatic system, the brain is what? Cleared. Then with the food restriction, the gut is repaired. Then patient becomes what? Better.
Sir, in case of adhesions, is it released?
Huh?
In case of any adhesions in the gut?
Addictions. See, addictions we don't treat too much.
adhesion in the sense any intestine or it is attached to other organs. That is surgical
Or
part.
addition. See, additions we don't get this case. GI cases we don't get much. I'm basically famous for brain and neuro diseases. Internal disease does not come to me. But then also I will teach you about the additions and all.
Thank you, sir.
More questions?
So is the 30 point or 30 yin point is sufficient to treat the disease? For example, if the excessive heat is in kidney, then definitely the heat may be also transferred to the urinary bladder.
G. Yin supports the yang, yang supports the yin.
Means if we treat the yin, yang is going to automatically nourish.
Covered, yes. If your wife is okay, house is peace. Try to understand the formula. Don't try to learn the points. Otherwise, hundreds of diseases, hundreds of points. You'll only do what? Learn theory. After some time, you will learn this theory and you can treat any type of disease, especially internal medicine. Am I clear?
Yes, sir.
Yes, sir.
Just try to focus. Little by little you will learn. Yesterday you learned very little. Today you learned very little. Tomorrow again you will learn very little. Neuroplasticity do not occur in a day. It takes time to understand something, right? But by understanding that, you can recover large number of what? Patients.
Of cases.
Yes, you see, I took out this formula from where Euclidean geometry. This geometry comes from Euclidean, which we read in class 8 or 9. Angles at the alternate segments are congruent. From there, I made it so simple. I co-established the relation between the disease. Which organ is affected from which disease? If one organ is affected, all organs are also going to be affected. Right? Am I clear? So, notice all the organs will refer, you can recover large number of patients. Am I clear? We are happy to announce that shortly we'll have a MOU with Philippines, and through Philippines, we can jointly give certificate together. For all the people.
Thank you, sir.
Thank you, sir.
Thank you so much, sir.
Thank you, sir.
Thank you, sir.
I
Thank you,
will
sir.
say thank you to
Thank you, G.
Danilo.
Thank you, sir.
Thank you, sir.
Danilo, are you there?
Yes, master, I'm here.
So very soon his society is going to be formed. We are having a MOU, and we will jointly issue the certificates.
Yes, Master. We are glad to be with partners with your institute.
Thank you so much.
शास्त्री सर
Thank you, sir.
You're welcome.
Sehat selalu guru.
हम बताइए,
सर कल से चालू है ना वेबिनार, कितने दिन के लिए?
मैं 9 तारीख को जा रहा हूँ केरला। 9, 10, 11, 12, 13, 14. On 15th we'll start from 9 to 14. I'm in Kerala for camp.
अच्छा, तो मतलब 8 तारीख तक चालू रखेंगे?
हाँ, 8 तारीख तक चालू रखेंगे।
ओके, थैंक यू।
Any more questions? Our class will be continued from 8, then again from 15 to we'll continue. Right?
Yes, sir.
Yes, sir. Thank you,
Yes,
sir.
sir. Thank you,
Yes,
sir.
sir.
Thank you, sir.
Thank you, sir.
Thank you, sir.
Thank you, sir.
I'm leaving, okay?
Thank you, sir. Thank you.
It's sir Ji.
Thank you.
Thank you.
Good night.
Good night.
Good night, sir.
Thank you very much.
Sir,
Good night.